All right, good morning. This is the Senate Health and Welfare Committee meeting. It is March 30th. And this morning, for the first hour of our meeting, we're going to go through a focus group process with some University of Vermont medical students who are here joining us. And before I introduce Sarah Caffrey, I'm going to have the Senate senators who are here to introduce themselves. So we'll start with Senator.
Hi, I'm Ruth Hardy. I'm senator from the Addison district.
I'm Cheryl Hooker. I'm a senator from Rutland.
Jenny Lyons, senator representing Chittenden County, where you all are, I think, right now.
Hey, good morning, Senator Josh Terenzini from Rutland County.
Okay, so one of our senators, Senator Cummings from Washington County, is testifying on a bill in another committee, so she'll be joining us midway through. I have copied out all of your questions for committee members, so they have that in front of them. And they did have those a couple days ago, so to give some thought. So I will introduce you, Sarah. Thank you for inviting us to be a part of your focus group process, and welcome. So I will turn it over to you for the next hour. There you go.
Well, thank you so much. And thank you for being willing participants in our focus group. So hello, both to members of the public on YouTube, but also to the Vermont State Senate Committee on Health and Welfare. Thank you so much for taking the time to speak with us today. My name is Sarah Caffrey. And I'm from Shelburne, Vermont. And I'm a first-year medical student at the Lerner College of Medicine at the University of Vermont. With me today, we have Giai and George, who are here largely for note-taking purposes, but also for answering any questions that may arise. I'll be the moderator of our focus group session today, and I look forward to our discussion. We are partnering with the Northern New England Clinical and Translational Research Network to perform a study on public health policy. The purpose of this focus group is to help the College of Medicine and the Northern New England group learn more about your experiences as a policymaker in Vermont and the process of developing health priorities for our citizens. The information you provide today will be summarized as a poster and or a report to share with the LCOM faculty and student body during a poster presentation at the end of the semester. The session will probably take somewhere between 30 minutes and 45 minutes. You can stop the interview at any time. Anyone is welcome to be the one to stop said interview. There is no penalty for choosing to end the interview. Does anyone have any questions for me before we begin?
Oh, I think we're fine. Does anybody have a question? I think it would be helpful as you're speaking to maybe slow down the pace a little bit, because it's difficult to hear everything when it comes through Zoom.
Sure.
Good, thank you.
No problem. Are we ready to start questions?
Sure.
Awesome. So this first question is one we're hoping everyone could provide a response to. And then beyond this, I think it probably also says in your question sheet that we're happy to have senators respond to questions in any order or not at all. Then we want this to feel more like a conversation than an interrogation. So any information you feel inclined to share is welcome and encouraged. So to start off pretty broadly, we're hoping that each senator could answer the question, what are the top health needs in the community or communities that you represent?
Anyone's going first? Okay, can I? Thank you. Thank you, Sarah, for doing this and for asking these questions. I think as a resident of Rutland County, I'd say one of our biggest needs is for geriatric care. Making sure that older people have access to quality health care and housing, which is really important for the health of our community. So that's one thing that I see. I don't know, and Senator Terenzini is a district mate.
Yes, I would echo what Senator Hooker offered and add that like the Chittenden County UVM community, Rutland is certainly feeling particularly a nursing shortage. And so we know that we need world-class nurses in our hospitals and doctors' offices. And so that's, I believe, affecting the health of our community. Also, we have seen since the pandemic began, clustering of homeless individuals in the community, which also plays into the health of our neighborhoods, right? So we need to figure out a better solution for the homeless situation in our community and find many more nurses to come work at our facility, the Rutland Regional Medical Center.
Absolutely.
Can we continue to talk about Rutland for a minute? Because, as she's in charge. Okay, it's we're an aging community in Rutland. I think we are probably one of the older counties. And so that is on my mind, but also along with that, or in conjunction with that, we have an issue with opioids. And that's another issue that certainly could affect the aging population, but certainly is across the board. And I think it can lead into homelessness. It can lead into certainly all sorts of health issues that we deal with on a daily basis in the community.
One last thought for me is, especially in our part of the state, we also lack primary care physicians. So not just nurses that I talked about, but we really need more family practitioners that can accept new patients, because most, as far as I understand, most practicing physicians now have closed practices where they're not accepting new patients because they can't take on anymore due to the volume. And we could certainly use some more community-based physicians and nurse practitioners and so on.
Absolutely. Thank you, Senator.
Do you want to go first or?
Either way is fine with me.
Go ahead.
Okay. So in my area in Addison County, some of our needs are similar to Rutland County. One of the first things I thought of was also sort of healthcare for our aging population, both long-term care facilities, nursing facilities, and also home-based home health and hospice services. So community-based services for being able to age in place in a healthy way and a respectful way. So just adding to what the senators from Rutland said, I completely agree. The other really big need in my county, and I think probably they will agree it's true for theirs too, is mental health services. Our designated agency has a 40% vacancy rate right now. So we have a really, really big need for mental health services, both crisis intervention, long-term counseling, specialized counseling, a very acute need for services for children and adolescents. So mental health is definitely at the top of the list. And then two other sort of issues I think statewide is substance use and recovery services with the opioid crisis still, unfortunately, a big issue in our state, and like more deaths last year than ever, except for one other year. That continues to be a big issue. And of course, just recovery from the pandemic and all the things that come with that. So I would still list COVID as a health issue, even though we're sort of in a different phase. And finally, for Addison County, we have a fairly large population of migrant farm workers. So access to healthcare for non-English speakers and for people who are not necessarily permanent residents, although many of them are permanent residents at this point, but really just having outreach and access. We have an open door clinic that does a really amazing job, but doing a better job of integrating their healthcare needs into the larger system.
Absolutely. Thank you, Senator. Senator Lyons, anything to add?
Sure, right. Look at everything that my that have said so far are pretty ubiquitous around the state, and that includes Chittenden County. So having access to mental health or substance use disorder from prevention, intervention, treatment, all of those things are critically important. And I think globally, we're looking at a need to understand how to mitigate social determinants of health. So for me, that's kind of the bottom line. What are those within our community? And we see many of them, including housing or transportation or others, drug use in families. So the overarching issue then becomes the linkages that we have in place between our primary care and family practices, and allowing for folks to move efficiently and gracefully through the system to access the type of care that they need. So we need to have a robust primary care practice. We need folks who understand cultural differences. You know, in Chittenden County, we have a high proportion of, I think similar to what Senator Hardy was saying about having ELL folks, people from other cultures. So we have a broad set of needs. And for me, putting in place some kind of connection between our primary care and then some care management into specialty care, or vice versa, stepping down, having step-down beds, eliminating the crisis in the emergency room. All of those things are so critically important. And so they're all there. And we're very much aware of the needs that we see both within the medical community and within the patient community. So they all somehow do connect.
Absolutely.
Can I just put in a word for dentists as well as
Yeah.
everybody else? I know sometimes we sort of separate dentists from doctors for some reason, but dental care is really important. We are suffering in Rutland County with a lack of access to dental care.
Right, that always has been treated separately. It doesn't make sense, does it?
No, it doesn't.
Dental care is healthcare, so thank you for bringing that up.
Yeah.
Absolutely.
Yeah.
Absolutely.
We're working
And,
on hearing aids in here, so we haven't separated out the ears yet. We're trying to include eyes and ears and teeth.
One part of the face at a time.
Right.
So those health needs in mind, opioids and aging population, access to medical providers, limited staffing. What do you think are some of the effective approaches, either currently in place or prospective methods to address those health needs? And I know that can be a pretty broad question. I don't know.
We have done, sorry, Senator Sharon. In terms of recruitment, we've tried to do a lot of creative support for nurses and other healthcare providers in terms of loan repayment and scholarship fund programs. We did a lot in that area last year. I think there's more in the budget this year, and ways to get people interested in going to nursing school or whatever, or medical school for high needs areas. Licensure, we worked on licensure a little bit, and how can we sort of smooth out the process for licensure. Last year we did a nurse licensure compact bill that we don't know what the impact will be, but also trying to figure out if there are ways to make licensure smoother for medical professionals. So those are two areas, recruitment and retention areas, but
I'll piggyback what Senator Hardy was talking about, the nurse compact bill, but we also, and I don't pretend to know what the fix is, but we also heard from, Senator Hooker and I specifically heard last summer from Castleton University down in our area that they could increase the nursing program dramatically, but there's a lack of clinical placement availability when nurses have to go out in year 2 or 3 or whatever it is to actually get hands-on training in our hospitals. So it's not just an academic problem, it's an actual hands-on problem. And so, like I said, I don't know what the fix is, but at least we've identified the problem. I'm excited that I was going to talk about the nurse compact bill. I was excited that we passed that to see if that gets us anywhere, because we also know that traveling nurses are much appreciated, but they are a huge financial drain on the budgets of our facilities in the state. So it's not sustainable for the long term when you're looking at the dollars and cents. And then the only other thing I would say is a lot of what we talked about starts with really good primary care. And so encouraging people to get a physician and get an annual checkup, as Senator Lyons talked about yesterday on the Senate floor, about primary care and the importance of that. And ultimately, I think we have to, as a committee, do everything that we can to make sure that healthcare is as accessible as possible to every Vermonter, and there shouldn't be roadblocks. It's really, let's see how we can help you, not let's see how we can block you from getting healthcare, because I think every Vermonter deserves it, quite frankly.
So picking up on the primary care piece, you know, what would be terrific would be to have at least 3 primary care visits a year for folks, so that they, without an out-of-pocket or a copay requirement, so that they are getting the prevention care that we need, and so then keeping them from getting sicker. And I think that's what Senator Tiranzini was referring to. It's absolutely critical. And then on the other side of that, ensuring that our primary care docs are reimbursed adequately, so that they don't feel like they're going out of business every day. So it's on. We need to do things on each side, so we can write policies that support both of those. But I think it's really important that we all understand that government can't do everything, and so we're seeing some really great things going on with our community hospitals and our other community services, where they're building housing for folks. That I know UVM is doing that, and I just read about another instance in the state where housing is being built to help. And then the other thing is we're moving into an era of greater telemedicine opportunities. And so when we talked about clinical access for nurses, my suggestion to the higher ed folks was, why don't you put a clinical telemedicine rotation in, so you can serve more students? That would allow for expansion. So there are opportunities with new tech that we can use. And I don't know, you all probably being exposed to that in a way that students in previous years haven't. So I think that's good. And there are other things we can do. I think people have talked about our regulatory flexibility and that stuff. So, but yeah, there's a lot that we can do. We can help. Money is always key, but there's a lot that we can't do, and it calls on each of the institutions to be working, and sort of everybody rowing in the same direction.
I think we talk a lot about continuum of care. And so, you know, from cradle to old age or even grave. But I think that is an important aspect of, you know, what we should be looking at to help facilitate that, whether it's, you know, from primary care, if you need specialist care, or from you know, hospitals and discharging from hospitals, to make sure that the care is continued once somebody goes home or goes to a facility. You know, that type of thing is really important for us to concentrate on.
You know, go ahead.
I just want to add that I think that there's often an assumption that professionals care for people, but I think what we've seen in this committee, and we did a bill, the bill that I'm thinking of that specifically highlighted this was a bill that we did about Alzheimer's. And the people who are caring for people with Alzheimer's are family. And we had a whole day where we listened to caregivers, and it was mostly women caring for other, daughters, mothers, and sisters caring for other people in their family. And it was really powerful to hear just how much healthcare families give each other and how little support there is for family members who are caring for other people in their home. And so, as Senator Hooker mentioned, the continuum of care, a lot of that care happens in the home, and whether it's giving birth in the home or dying in the home, like both are things that we've actually touched on this session in this committee, from the full spectrum, and realizing that, with all due respect to all the medical students who are going to become doctors, much of the care that happens with families.
Another bill that we're dealing with is developmental disabilities and aging parents who are so concerned about what's going to happen with their loved one when they're no longer able to care for them. So dealing, just piggybacking on what Senator Hardy said about the families being so important in the continuum of care.
So then to bring it back to you, one of the things that we can do is to link I'm just gonna stick with primary care for now, but one of the things we can do is to link primary care practices and family practices with our community organizations, including schools. And so you mentioned dentistry earlier, or mental health. What a great way to connect physicians with kids, whether it's a child psychiatrist is not a primary care, but it can come down to that need. So so those community linkages are very important. And then I'll just say one other thing. One of the things that we don't hear enough about is how can we measure the outcomes for the work that's going on. And so from a public health perspective, it's really important to know what effect the work we're doing is having on an individual group. So whether it's another culture, folks who have immigrated into the state, don't speak English, or whether it's a group of folks who need clinical treatment for diabetes or something else, that we have the opportunity for electronic databases that can allow for an analysis of best clinical practice and move us forward in that way. We can, in this building, we can pass laws that facilitate that. And then we'll help you as you move out and do your practice. You don't have to go about trying to sort out what's the newest and latest thing that's happening. So we need to have that. There's an opportunity there again for our new technologies to help.
We're never going to get through this list. We all need to stop talking.
We have a long.
Oh, and it's totally fine. We anticipate not doing every question where that's just kind of a baseline. Thank you so much. I mean, you've done an exceptional job describing both the health needs in your communities and avenues for improvement. And that really is what we're interested in, is where legislators are getting their information from, where they are determining that they need policy attention focused. And so we in particular have done quite a bit of research about the community health needs assessments, which is one way that health needs are assessed. They're completed every 3 years by all major hospital networks nationwide as a requirement for the IRS in order to receive federal funding. So we are wondering how familiar are members of the Senate with the CHNAs?
So I think the more recent one is either just coming out or hasn't quite come out. So I look at it on a regular basis, and it does inform us, but it's not the only data set that is available to us. Obviously, some of the folks that we used during the Alzheimer's bill or other bills our advocacy organization. So we get information from both Department of Health or national groups as well as more local community groups.
We hear a lot from our hospitals and our agencies in the community. We meet with them pretty regularly in Rutland and hear their needs. And I have to say that they have a lot of need, a lot of, whether it's workforce or just trying to connect all of the agencies so that they can be doing they can be taking care of people as their needs are required without overwhelming the system with people who are perhaps not in as much need. I don't know what I'm trying to say here, except that, there's a huge need out there and we understand that, and it's almost overwhelming to try to come up with a solution. Well, it is overwhelming to try to come up with a solution. Now we go back to
So your question about community health needs assessment is something that we don't look directly at in the committee. We may do that, understanding that it is more hospital centric, but it does inform us. I think that the Department of Health has most of the data necessary for us, to look at outcomes, and so that's probably the place that we go more than any other. But others can speak for themselves.
Absolutely. And is this Senator Cummings?
yes.
Yes.
Hi, it's nice to have you here as well.
I was explaining corporate taxes to another committee.
Oh, sounds like a blast.
It was exciting.
Everything medical care is confusing.
Yeah, so what you need to understand, Sarah, is as senators, we are on two committees. So Senator Cummings is chair of the Finance Committee. So we lose her from time to time when she has to testify somewhere else.
Oh yeah, I can imagine.
That she's on the Finance Committee. She and Senator Hardy, so that they could keep us on track as far as, we'd like to do everything for healthcare.
But money is finite.
But money is finite.
Oh, I can imagine. So Senator Cummings, we started out by introducing ourselves and what community we represent, what county, and then if you would be willing, and not to throw you right into the thick of it as you just walk in, but we are just asked every senator to just kind of rattle off what they see as some of the top health needs in their communities that they represent.
I represent Washington County, which is right here. We are fortunate, I think, in that we have Central Vermont Hospital, which is affiliated with UBM. So even though it has its struggles, we tend to have, we're the big city in Central Barre, Montpelier. We have a cluster of medical services. Other areas of the state, I remember years ago, we were looking at services for children with autism. In Central Vermont, you could cobble those together. In other areas of the state, you couldn't. So I think primary care, my primary care doctor retired, and I think I was in the same office. I got bounced around to 3 or 4 other primary care docs, which basically I saw for my annual physical. One of them I never even saw. She came and left. Eventually that office closed down as primary care. And I got shifted, probably because I'd been there the longest, to one of the UVM primary care clinics over in Barre. My daughters just got told you'll have to find a primary care doc on your own. And that, and that's an issue here. You get into the more rural areas, it's definitely an issue.
Absolutely. So it sounds like you're unknowingly echoing very much what your colleagues have been saying about a difficulty with access, particularly to primary care. So we then moved on to discussing what sort of tools and resources inform decision-making around health policy. Specifically, we touched on the community health needs assessments that are performed by hospitals every year, but not just Senator Cummings, this is to the whole group, wondering what other tools and resources do you use that help you to identify the health priorities in your community?
Yeah, well, I'll just say one thing, that we frequently as legislators ask for information, so through reports. So a lot of the bill work that we do, legislative policies we do, are really looking to understand further. So we might ask of the Department of Health, or we might ask of our Joint Fiscal Office for fiscal information about healthcare. And so we have a stack of reports that we review as we look at bills. So it could be something about prescription drugs, or it could be something about primary care access, or others. So the reports that we get are fundamental to our understanding of what's happening in our communities and state.
Use the Green Mountain Care Board.
Green
Sure.
Mountain
And do
Care
you, oh, sorry.
No, go ahead.
Do you solicit these reports, or do they come to you?
We solicit them in legislation, and then we send them to the committees of jurisdiction. So we would get the reports that are pertinent to healthcare finance, and so on. And we have them all right on our webpage, so we can go and look up what we need to.
I would say that in addition to all of the sort of formal means like reporting or hearing from official individuals or institutions, I get a lot of my information from my constituents and what I'm seeing and hearing from them, and what impact, what issues are impacting their lives. That for me is the most valuable. And when I first ran for office in 2018, and before the pandemic, was able to knock on a lot of doors and talk to people in their homes, the number one thing people talked to me about was healthcare, more than any other issue. Broadly speaking, not just, access to healthcare, cost of healthcare, individual health needs, their personal family stories about what was going on, just a whole broad array of health related or health and human services related, because we are the Health and Welfare Committee, so we also deal with related things like childcare and things like that. So just broadly speaking, those were the number one area of concern for people. So that drives a lot of what I prioritize and what I think will have the biggest impact on my constituents and the actual people in our state.
And as Senator Lyons said, the advocates, sometimes our constituents work with groups or people who then come to our committee to express the concerns that the broader community has. So, if we have our healthcare advocate, for instance, who will come to us with needs, dealing with all sorts of things, whether it's access or cost. So yeah.
Yeah, so I think that it's a combination of our neighbors and then the advocacy organizations. It's hard to write a bill because one person tells you a story, but on the other hand, if you start hearing those stories across the board when you're visiting with folks, you begin to think we gotta do something. And so that, I think it all sort of integrates one with the other.
Absolutely. And that's something that's, I grew up in this state, and it's special to have a small enough place where you feel like you can access your politicians and let them know what you personally find valuable. And so a bit more specifically, we've addressed the identification of health needs in our communities, but specifically we're curious about the needs of more vulnerable communities, and wondering if there are any tools or resources you find specifically beneficial for assessing the needs of particularly vulnerable groups, whether that be children or the elderly or those with chronic illness, and or our minority communities.
Go ahead.
No, I was gonna say who's first.
I think this is always on our minds, and I mentioned at the outset, in my district, migrant farm workers are a particularly vulnerable community and don't have their healthcare needs are not fully met by our system. And so the free clinic often is their healthcare provider. This was really underscored during the pandemic, when there was a major outbreak at one of the farms in my district. It impacted a bunch of migrant farm workers who were working on an orchard. I think that became more visible to the community. And I used to be the director of the Open Door Clinic, so it's kind of top of mind for me all the time. And how do we serve people, migrant farm workers, but also others who are underinsured or uninsured in our community, and just don't have access to the system the way that other people do. So that was the first job I had when I moved to Vermont 20 years ago. So it was sort of what introduced me to our healthcare system. So it's always really what I think of first, is trying to find access to healthcare for people who don't have immediate access for a lot of different reasons. And also in my district is a college, Middlebury College. And so thinking about how do students and young people have access to our system who may not live here full-time or aren't familiar with Vermont, and what are specific needs for that generation, basically. Just as an example, access to services for people who are experiencing eating disorders. And I actually just heard from a constituent about this, but this is true for college students too. And there just are not enough services in our state for people who need care related to eating disorders. I think, and young families also often have difficulty accessing services for a number of reasons.
Mm-hmm.
The school in my, one of the schools in my district has a school-based health center, and that is a really amazing way to provide access to people who wouldn't necessarily have access to primary care and a pediatrician's office. And I think we've all seen during the pandemic the importance of school-based services. And so I think that's a good way of reaching some people who wouldn't necessarily normally have access or are vulnerable, because families almost always have some kind of touch with their school. And so being able to combine those services is really helpful.
And we did some of that with community schools, right? The program that would have services available at the school. And I think, that's, as Senator Hardy said, really important, because the schools are often the center of the community. And so that's a good place to have that touchstone. Also, I'm thinking of parent-child centers. And, I think we do a pretty good job with taking care of our little ones, but certainly kids who are in situations where, their families are low income, they have access, some of them have access to the parent-child centers, and those are really important places for families to get the support that they need, whether it's feeding people or, just emotional support, whatever they do.
Yeah.
So I'm gonna jump in a little bit because it's interesting with that, when we get put together on a committee like this, we don't know a lot about each other. We just know that we're here. But when I was in graduate school, I began a migrant care clinic. There was no such thing, animal back then, and I won't tell you how many years ago it was. But because I was bilingual, I could teach and work with families, and so we put that together. And now some of those places have matured to the point where we have that work going on in Addison County in our state, and also in other parts of the state, with free or reduced cost clinics through our F2HCs or federally qualified health centers or others. So it's kind of neat to see that happen. And those folks really are vulnerable for a lot of reasons. They can't speak the language, and they need access for care that's maybe difficult for them to explain. So one of the needs I think that we need to look at is sort of the linguistic skills, the language skills that folks have. And that includes you, so how you can communicate. Yeah, the other area where we think about vulnerability, of course, are things that folks have already mentioned, and that's the disabled population. And that we have families caring for our family members. We also have put in place in this state what's known as choices for care for our highest needs older Vermonters, so that they can stay at home to the extent possible. We would like to expand that if we can. So vulnerability is a huge issue, but having people socially isolated and don't have the resources to go out and access care is a big concern. That's why when we talk about care management and connections, I think that is so critical in solving some of the problems we're seeing. And also then, of course, it's always about money that Senator Cummings is going to raise for us.
I just.
How to pay for all this.
Yeah, I mean, in the end, it comes down to resources, which means money. I think we know a great deal of what needs to be done. The challenge is, how do we pay for them?
Mm.
And other countries provide a lot more, but other countries have a much higher tax rate percentage of their income. My son lives and his family live in Canada. My daughter-in-law gets a year's paid leave, maternity leave. We don't get that here. We're struggling for 6 weeks. Paid, family leave, a lot of those other benefits that we don't have, but they pay 50% of their income in taxes. So
Absolutely.
that's a struggle here, because people hear that other places have all these services, but we never talk about, they really aren't free. It's just, you pay, if you're a lower income person, you pay less, but you pay the same percentage of your income, but you are guaranteed the service. And that's a struggle that I think some of us have been through the single payer wars in this building and have failed. And it's difficult.
It was about not wanting to pay, right?
Twice the bill has come in, and once before my time, believe it or not.
Yeah.
It's before yours.
Yeah.
But bill has come in, and it's just been higher than we feel people would be willing to pay.
That seems to be-
I mean, but think of that, along those lines, Senator Cummings, and the when we think about we're gonna pay for it, but then we also know the inflation rate, the medical inflation rate is so much higher than other inflationary provisions. And we know, I mean, for example, hospital inflation rate nationally over the past 10 years is 200%. And that's unsustainable. In our state, we're a little bit better because we have the Green Mountain Care Board, but if we start thinking about paying all in for healthcare, we're thinking about paying into a system that has an inflation rate that puts significant pressure, downward pressure on all of us. So, anyway, we could go
We
on
won't talk
about
about
that.
pharmaceuticals.
I know, don't.
And then to expand on that a little bit, Senator Lyons, maybe to put you on the spot a little, we know Vermont is a predominantly white state. And I know I'm from Chittenden County, and I know that our county, while predominantly white as well, does have a significant refugee population. And I'm wondering if, we've talked about, age-based demographics, and we've talked about migrant workers, we've talked about disabled folks. I was wondering if you can maybe touch on refugee and minority populations.
Oh, yeah, sure. This is good. So, so we do have a racial equity director sitting in the Agency of Administration, and that's Susanna Davis. And she's been working very hard with a large group of folks. I'm going to start with that, and then I'll go to some other things. A large group of folks on making recommendations to us about integrating racial equity issues into the healthcare system overall. That's going to be a large policy work on our part. So, but to go down back to my constituent level, I am very sensitive to the need for equity and infusing our knowledge of needs within our healthcare programs. So obviously I represent Winooski and Burlington with a huge population of folks from other countries and other cultures. And we understand that it's not just the language that is needed, but it's also an understanding of the cultural differences and helping people move from where they have been to where we are, or at least become aware of the differences themselves. I will say that when the pandemic started, we put in place, we asked the Department of Health in legislation to begin to categorize and to save data about how differences in our racial populations, whether they be Black, Indigenous, or what other racial or ethnic group, to understand differences in response to COVID. And the Department of Health is doing that, and they broadened that, which is really excellent and informative. It's the beginning of what we'd like to see more of. And then more recently, I think it was last summer, we approved, we don't really approve it, but we are excited to see it, over $28 million grant that the Department of Health has for 19 limited service positions to put in place with the CDC to put, it's a prevention program for, I have it here, for health disparities and high-risk racial and ethnic groups to understand their needs within the healthcare system. So we are a white state and we don't have the experience. And so the literature that perhaps that our researchers is reading is not related as much as it might be with a broader population. So by putting this grant in place, or by making us aware through the Director of Racial Equity's work of those health disparities, we can work together to put a system in place that's welcoming regardless of where folks are coming from. So we're at the policy level. On a very personal level, I think we all integrate well with others, and we have friends of different racial and ethnic groups, and we're very concerned about our constituents. But to ensure that the data that we're collecting and the work that we're doing would reflect needs within those communities is really important.
I think it's really a catch-22 here too, because the pockets of BIPOC people are limited in the state. it's mostly in Chittenden County. I would say that the majority of these people are living, and that's where the services would be. So, we're beginning to see people move, kind of migrate south a little bit. I mean, we have some refugees who have come to Rutland County. It's easy to serve them because there's a small population, but we need to expand those services so that we can accommodate more people coming to the area.
I think the real challenge we have that we've always had is that we are a rural state. And that when immigrants come, the settlement people make sure they go to places where there are services available. And so they are in Chittenden County. Part of my mental health therapy during COVID is I've driven to parts of the state that I've not seen before, mostly in the Northeast Kingdom. We are having the same issues with rural health care that other rural states are having. How do you keep our hospitals solvent? How do you keep doctors? How do you make it so they can afford to be in those communities? You have access issues with vehicles. I mean, there's no public transportation. People need to be able to get to their doctors. It's, that's our primary, I think. Politically now we are very focused on BIPOC, and we should be, but we can't forget that group of people that have been with us for years, who have not had either financially or just the transportation, the time, getting time off from work, all the issues that keep you from being there. We've had doctors come in and say, I went up to the Kingdom. He said, if you're up there where most of your patients are on Medicaid, you cannot financially make it. And that's a challenge for us, is how do we make it possible for doctors to be able to afford to work in the areas that need the services the most?
Absolutely.
I would just add, Sarah, that we have an aging population. In fact, we're one of the oldest states in the nation. The oldest. Thank you, Senator Cummings. And we also have, I think it was 12 out of our 14 counties over the last 10 years, we've seen a declining population. In fact, Senator Hooker and I, for a little while over this past few months, we didn't know if we were even going to be able to maintain 3 senators from our county.
Washington County, the same.
So
Wow.
I bring that up because we need to welcome, we don't just want to, we need to welcome and invite new Americans and immigrants and refugees to our state for the long haul, for sustainability. But it's not going, when someone's looking to move here, they're going to look, one of the first things I know I would look at is healthcare and availability. Or am I going to move to a suburb of Boston or New York City or Philadelphia? Well, I want to make sure as a senator that we have a robust healthcare system that's going to attract new Vermonters, because if we don't do something fairly quickly, we're going to continue to see higher taxes, right? There aren't going to be enough people here to pay their fair share. We have an aging population. We already have a career, everyone in Vermont is hiring right now because we don't have enough people. So I know I threw a lot at you, but it all comes back to my mind is one of the pillars of a community is healthcare.
Absolutely.
And one of the things I think that we've tried to do is to be cognizant of the debt load that people like you carry, and what can we do to help you get up from under that debt so that you're willing to stay in an area where, we can't pay as much as the big cities do, or stuff like that.
Absolutely. So, overall, we've discussed rural healthcare, aging Vermonters, disadvantaged and underrepresented populations. Senator Hardy, I thought your mention of care for college students was a particularly great point to highlight. I went to Middlebury College and know that I was very fortunate to have, my home PCP that I could go to. And I know that both at UVM, I'm sure Castleton as well, all of our universities in the state probably have a more transient population that too need to be taken into account for that healthcare. But overall, I really do appreciate your thoughtful responses. I want to close up with you guys as it is about 10 o'clock, but thank you so much for discussing your experiences with developing health policy and the processes involved in working together with the state of Vermont as a whole to deliver the best care possible and enact the most efficient public health policies to fit the needs of our individual counties, but also our state as a whole. Clearly, there are quite a few hurdles, not the least of which being money. But we appreciate, and it is very reassuring to witness policymakers who demonstrate an awareness for that limitation and still express their concern and their recognition for needs in the community. So we want to close by saying, again, thank you so much, both the Lerner College of Medicine and the Northern New England Clinical and Translational Research Network, as well as our student research cohort specifically. Really appreciate your feedback and participation. If you have any questions for us, please feel free to contact us if you'd like us to share any additional information, or if you would like to share any additional information with us. Contact information I will be sending to Erin Denammer, and it will be made available to you hopefully shortly. So thank you again, and wondering if you have any questions for me before we take off and let you get back to business.
Well, keep us posted on your poster. Let us know when your poster goes up.
Absolutely. It should be sometime late April, maybe early May, but I will make sure that you are all in the loop for that.
Thank you very much.
Thank you so much.
All right. Thanks for your perseverance and listening to us.
No problem. Thank you. Have a great rest of your day.
Yeah, take care. All right. We can go.